Have you ever experienced persistent bloating in your abdomen that simply refuses to disappear? Or perhaps a constant pressure sensation in your lower pelvic area that medical professionals dismissed as insignificant? What if these indicators were actually your body attempting to communicate something far more dangerous, something potentially life-threatening? Each year, more than 313,000 women across the globe receive an ovarian cancer diagnosis. And the truly shocking part? Over 70% of these women are diagnosed during late stages, when treatment becomes significantly more challenging. The reason behind this? These symptoms frequently disguise themselves as ordinary digestive or urinary problems. Silent, subtle, easily overlooked. Here's the reality most women aren't aware of. The majority don't even realize they're facing risk until it becomes too late. But what if you could identify it early simply by recognizing 12 warning indicators that countless women disregard? Today, I'm revealing 12 scientifically researched symptoms of ovarian cancer that every woman and every person who loves them should understand. Some of these might genuinely surprise you. And warning sign number 7, most medical professionals don't even discuss it, yet it appears in thousands of early diagnosis cases. Stay through to the conclusion. I'll also demonstrate how to respond appropriately when immediate action is necessary and what you should absolutely never dismiss. Your health represents your greatest power. Let's safeguard it together. Drop a comment telling me where you're watching from. I genuinely want to hear from you. Quick note, this content serves educational purposes only and doesn't replace professional medical guidance. All research mentioned has been verified and references are available in the description below. Now, here are the critical warning indicators of ovarian cancer that demand your close attention. Warning sign number 1, persistent bloating. That bloated, stretched sensation in your belly that absolutely refuses to disappear. It's far more than simple discomfort. This could be your body's method of signaling something serious. Most women experience bloating occasionally, especially around their menstrual cycle or after eating certain foods. But there's a significant difference between normal bloating and the kind that serves as a warning signal for ovarian cancer. Normal bloating comes and goes, usually resolving within a day or two. Cancer-related bloating, however, is persistent and progressive. Ovarian cancer frequently manifests in subtle ways, and persistent bloating ranks among its earliest indicators. In research published in the Journal of Gynecologic Oncology during 2023, scientists discovered that persistent abdominal bloating or distension represents the symptom most commonly linked with ovarian cancer. This finding emphasizes the critical importance of recognizing bloating as a key indication of this disease. What makes this bloating different? Women describe it as a constant feeling of fullness or tightness in their abdomen that doesn't improve after bowel movements or passing gas. Your clothes might suddenly feel tighter around the waist, and you may notice your abdomen appears visibly distended or swollen. The bloating associated with ovarian cancer often worsens as the day progresses. You might wake up feeling relatively normal, but by evening, your abdomen feels significantly more swollen and uncomfortable. This pattern occurs because tumors can cause fluid accumulation in the abdominal cavity, and gravity causes this fluid to settle throughout the day. If you're experiencing bloating that continues for longer than 2 weeks, especially if accompanied by additional symptoms like pelvic discomfort or appetite changes, consulting a healthcare professional becomes crucial. Early ovarian cancer detection dramatically improves treatment success rates. Warning sign number 2. Pelvic or abdominal pain. You understand your body better than anyone else, so when an unusual, persistent ache appears in your lower abdomen or pelvis and refuses to disappear, paying attention becomes worthwhile. This type of pain can present as a dull cramping sensation, a pulling feeling, or even sharp stabbing sensations. Many women dismiss it, attributing it to digestive issues or their menstrual cycle. But when that pain persists for weeks, it might indicate something more serious. The pain associated with ovarian cancer typically has certain characteristics that set it apart. It's often described as a deep, internal ache rather than surface pain. Women frequently report feeling like something is pressing or pulling from inside their pelvis. The pain might radiate to the lower back or thighs, creating a sensation that's difficult to pinpoint. In ovarian cancer, this pain frequently results from tumors applying pressure on surrounding tissues or organs. As the cancer develops, it can stretch the abdominal lining or invade nerve pathways, triggering discomfort. According to research published in JAMA Oncology during 2023, over 63% of early-stage ovarian cancer patients reported pelvic or abdominal pain as their initial noticeable symptom, often appearing weeks before diagnosis. The challenging aspect is this pain doesn't always present intensely. It might appear intermittently, but the pattern provides the clue. If it's new for you, occurs more than 12 days monthly, and keeps returning, don't disregard it. Many women tell me they dismissed this pain for months because it wasn't severe enough to stop them from daily activities. Another important characteristic is that this pain often doesn't follow your menstrual cycle pattern. Postmenopausal women should be especially alert, as any new pelvic pain after menopause warrants immediate medical evaluation. Warning sign number 3. Feeling full quickly. Have you ever noticed feeling completely full after consuming just a few bites, even when you haven't eaten much throughout the day? This sensation, medically known as early satiety, might appear trivial, but it's a symptom deserving serious attention. Imagine sitting down to eat your favorite meal, something you normally enjoy completely, but after just a few forkfuls, you feel uncomfortably full, as if you've already eaten a large meal. Your stomach feels stretched and tight, even though logically you know you've barely eaten anything. In ovarian cancer, tumors can develop and apply pressure against the stomach and surrounding organs, reducing stomach capacity and creating that premature fullness feeling. Additionally, fluid accumulation in the abdomen, a condition called ascites, can intensify the sensation by increasing pressure within the abdominal cavity. Research published in the Indonesian Journal of Cancer during 2024 highlighted that early satiety appeared among common complaints in patients with advanced stage ovarian cancer. The research emphasized that symptoms including abdominal discomfort, bloating, and early satiety were prevalent before diagnosis, underscoring the importance of recognizing these indicators early. This symptom often leads to unintentional weight loss, which many women initially welcome without realizing the dangerous cause behind it. You might find yourself skipping meals because eating feels uncomfortable, or you might start eating smaller portions throughout the day just to avoid that overwhelming fullness sensation. If you consistently experience early satiety, especially when accompanied by other symptoms like bloating or abdominal discomfort, consulting a healthcare professional becomes crucial. Don't dismiss this symptom as simply getting older or having a smaller appetite. Warning sign number 4. Frequent urination or urgency. Frequent urination might appear as a minor inconvenience, perhaps just an indication of excessive water consumption or a mild bladder concern. However, when this symptom appears suddenly and persists without obvious explanation, it could represent an early indicator of ovarian cancer. This isn't about drinking more water and consequently needing to urinate more often. This is about a sudden, unexplained change in your urinary patterns. You might find yourself needing to urinate every hour or even more frequently. The sensation of urgency can be so strong that you feel you might not make it to the bathroom in time. The ovaries are positioned near the bladder, and as a tumor develops, it can exert pressure on the bladder, creating increased urinary frequency and urgency. This pressure diminishes the bladder's capacity to retain urine, causing you to experience the need to urinate more frequently, even when the bladder isn't full. Research published in the Journal of the American Medical Association discovered that 55% of women with ovarian cancer reported urinary symptoms, including frequency and urgency, compared to 32% of women presenting to primary care clinics without ovarian cancer. This significant difference highlights the importance of recognizing urinary changes as potential early indicators of ovarian cancer. Many women initially attribute these symptoms to a urinary tract infection and might even try treating it with antibiotics. However, when a urine test comes back negative for infection and the symptoms persist, that's a critical red flag that something else might be causing the problem. If you're experiencing persistent changes in your urinary patterns, consulting with a healthcare professional becomes essential. Don't let embarrassment or the assumption that it's just a bladder issue prevent you from seeking proper evaluation. Warning sign number 6, fatigue. Feeling completely exhausted even after a full night's sleep? If you're constantly battling exhaustion that rest doesn't resolve, it's more than just being busy. It could be your body signaling something deeper. For many women, this relentless fatigue isn't simply about daily stress. It's a symptom that often precedes an ovarian cancer diagnosis. Normal fatigue improves with rest. Cancer-related fatigue is different. It's a profound, overwhelming exhaustion that persists regardless of how much you rest. Recent research from the Oncology Nursing Forum provides insight into this phenomenon. In a study involving 233 women undergoing chemotherapy for gynecologic cancers, including ovarian cancer, researchers identified distinct fatigue patterns throughout the day. Notably, over half of participants experienced high or very high fatigue levels both during morning and evening hours. This persistent tiredness was connected to factors including younger age, higher body mass index, and increased anxiety and depression levels. Such fatigue didn't just affect energy levels, it impacted sleep quality, cognitive function, and overall life quality. What causes this overwhelming fatigue? Cancer cells compete with healthy cells for nutrients and energy. Your immune system works overtime trying to fight it. If the cancer affects your ability to eat properly due to early satiety or nausea, you're not getting adequate nutrition to maintain energy levels. If you've been feeling unusually drained for weeks without clear reason, paying attention becomes essential. Track your energy levels, note when the fatigue started and whether anything makes it better or worse. This information will be valuable when you discuss your symptoms with a healthcare provider. Warning sign number 7, menstrual irregularities. Irregular periods sometimes represent more than just a minor inconvenience. They might represent something more serious, and this is the symptom I mentioned earlier that most doctors don't adequately discuss with their patients. If your menstrual cycle becomes irregular, with periods arriving closer together, lasting longer, or accompanied by unusually heavy bleeding, taking notice becomes essential. These changes could be your body's method of indicating something isn't quite right. A significant study published in the International Journal of Cancer followed over 15,000 women for 5 decades. The findings were striking. Women who experienced irregular menstrual cycles showed a 2-fold increased risk of ovarian cancer by age 70, and this risk nearly tripled by age 77. This research challenges the previous belief that fewer periods might lower cancer risk due to reduced ovulation. Instead, it suggests that hormonal imbalances causing irregular cycles could contribute to ovarian cancer development. For premenopausal women, sudden changes in menstrual patterns warrant investigation. This includes periods that become significantly heavier than your normal flow or occur more frequently than every 21 days. For women approaching menopause, if you experience bleeding after 12 months of no periods, this requires immediate medical evaluation. If you've noticed persistent changes in your menstrual cycle, consulting with a healthcare professional becomes crucial. Keep a detailed record of your menstrual cycles, including start dates and end dates, flow heaviness, and any associated symptoms. Warning sign number 8, indigestion or heartburn. That burning sensation after meals or the bloated feeling that simply won't disappear. Many of us attribute it to something we consumed or stress. But when indigestion or heartburn becomes a regular part of your day, paying closer attention becomes worthwhile. In some cases, these seemingly minor digestive concerns can be early indicators of ovarian cancer. Recent research from the UK collaborative trial of ovarian cancer screening highlighted that gastrointestinal symptoms, including indigestion and heartburn, were reported by 35% of women with early-stage high-grade serous ovarian cancer. Interestingly, these symptoms were more prevalent than traditionally recognized gynecological signs, like vaginal bleeding. As tumors grow in the pelvic or abdominal cavity, they can press against the stomach and intestines, disrupting normal digestive processes. This pressure can slow gastric emptying, meaning food stays in your stomach longer than it should, leading to feelings of fullness, nausea, and acid reflux. The heartburn associated with ovarian cancer often doesn't respond well to typical over-the-counter antacids or acid reducers. If you've been taking medications for heartburn regularly for several weeks without significant improvement, or if the symptoms keep returning despite treatment, this warrants further investigation. If you're experiencing ongoing indigestion or heartburn that doesn't respond to usual treatments, consulting with a healthcare professional becomes essential. Don't let yourself or your doctor dismiss these symptoms as just getting older. Warning sign number 9, swollen abdomen with fluid. You might notice your belly gradually getting larger, yet you're not gaining weight. Clothing starts feeling tight around your waist. It's not fat accumulation, it's fluid buildup. In ovarian cancer, this accumulation is called ascites, and it occurs when cancer cells irritate the abdominal lining. Your body reacts by leaking fluid into the space surrounding the organs. It's not just uncomfortable, it can make breathing, eating, or even moving comfortably difficult. Your abdomen might appear distended or swollen, particularly in the lower belly. When you press on the swollen area, it might feel firm or taut, different from soft fat tissue. The swelling from ascites typically affects the entire abdomen, rather than being localized to one area. Doctors often describe this as a warning indicator, especially when the swelling keeps returning or worsens. According to research published in Nature Reviews Cancer during 2015, women with newly diagnosed epithelial ovarian cancer presented with moderate to severe ascites. The study discovered that ascites presence was connected to more advanced stage disease and poorer outcomes. As fluid accumulates, you might experience additional symptoms. Your legs and ankles might swell. You might feel short of breath, especially when lying flat, because the fluid pushes up against your diaphragm. Eating becomes difficult because the fluid takes up space. If you or someone you know struggles with unexplained abdominal swelling that keeps returning, asking your doctor for a pelvic ultrasound or further testing becomes worthwhile. Warning sign number 10. Nausea and vomiting. Some women are caught off guard by a symptom they'd never connect to ovarian cancer: nausea and vomiting. It presents like a stomach bug, food poisoning, or just poor digestion. But when it persists for days or keeps returning without any clear cause, it deserves attention. As ovarian tumors develop, they can press against the stomach or intestines, slowing down digestion or even blocking parts of the bowel. This can trigger chronic nausea and sudden vomiting, especially in later disease stages. Research published in Gynecological Oncology during 2022 followed over 1,100 ovarian cancer patients and discovered that nearly 36% reported nausea or vomiting during the diagnostic period, often misattributed to common gastrointestinal issues. This isn't the acute, severe vomiting you'd experience with food poisoning that resolves within 24 to 48 hours. This is persistent, recurring nausea that might be mild to moderate, but constant. You might wake up feeling queasy, experience waves of nausea throughout the day, and find that certain smells or even the thought of food triggers intense nausea. What makes this even more concerning is that many women delayed seeking help, thinking it was dietary or stress-related. However, when these strategies don't provide lasting relief and the symptoms persist for weeks, it's time to consider other causes. If nausea or vomiting appears with no obvious reason and keeps returning, don't ignore it. Document when it occurs, what triggers it, and how long it lasts. Warning sign number 11. Pain in legs or thighs. Leg or thigh pain isn't typically the first consideration when discussing ovarian cancer. However, for some women, it's an early indicator that often gets misattributed to muscle strain or sciatica. The discomfort usually presents as a deep ache or cramping sensation, sometimes radiating from the pelvis down into the thighs. This occurs because a growing ovarian tumor can press on nerves and blood vessels in the pelvic area, disrupting circulation and irritating nearby nerves, leading to persistent leg pain. Major nerves that supply sensation and motor function to the legs pass through the pelvic region, very close to where the ovaries are located. When an ovarian tumor grows large enough, it can compress these nerves and vessels, causing symptoms in the legs even though the problem originates in the pelvis. A case study published in the American Journal of Case Reports during 2024 detailed a 31-year-old woman who experienced increasing sacrococcygeal pain and right leg paresthesia over a 2-year period. Initially treated for musculoskeletal issues, she was eventually diagnosed with a large right ovarian mucinous cystadenoma. Surgical removal of the tumor led to complete remission of her symptoms. The leg pain associated with ovarian cancer is often unilateral, meaning it affects one leg more than the other. The pain might be described as a deep ache, burning sensation, or cramping that doesn't correspond to any specific injury. If you have persistent leg pain or thigh pain that doesn't respond to typical treatments for musculoskeletal issues, especially if you have other symptoms mentioned in this video, asking your doctor for a pelvic examination becomes essential. Warning sign number 12, unusual vaginal discharge. It's easy to overlook changes in vaginal discharge, especially if they seem minor. But when that discharge becomes unusual, persistent, watery, bloody, or foul-smelling, it might be your body signaling something more serious, like ovarian cancer. While not the most common symptom, certain types of ovarian cancer, particularly stromal or germ cell tumors, can cause such discharge. These tumors may produce hormones or disrupt nearby tissues, leading to abnormal secretions. Normal vaginal discharge varies throughout the menstrual cycle, typically being clear to white with a mild odor. Concerning discharge associated with ovarian cancer is different. You might notice discharge that's persistently watery, almost like water that soaks through underwear continuously. The discharge might have a pink or brown tinge, indicating small amounts of blood. Some ovarian tumors, particularly those that secrete hormones, can cause changes in the uterine lining that result in abnormal discharge or bleeding. An article published by the Centers for Disease Control highlighted this connection. Researchers discovered that women with early-stage ovarian cancer reported persistent vaginal discharge as their only noticeable symptom. Postmenopausal women should be especially alert to any new vaginal discharge as the vaginal environment typically becomes drier after menopause. Any new discharge after menopause, especially if it contains blood, requires immediate evaluation. If you notice any unusual discharge that doesn't resolve or seems out of the ordinary for you, consulting with a healthcare professional becomes crucial. Don't feel embarrassed discussing these symptoms with your doctor. That's everything for today. If you made it this far, thank you for being part of this important conversation. Remember, awareness saves lives, and just knowing these indicators could make all the difference for you or someone you love. Now it's your turn. Have you or someone you know ever experienced any of these symptoms? Did you notice something you've been ignoring? Share your thoughts or story in the comments. I'm here to listen. If this video was helpful, please type helpful in the comment section. That one word motivates me to keep creating more life-changing content just like this. Don't forget to like, share, and subscribe so you never miss future updates. Until next time, stay safe, stay aware, and take care of yourself.